Remember the components of the revised trauma score. That is, number 1 is the Glasgow Coma Scale, GCS. Number 2 is the systolic blood pressure. Number 3 is the respiratory rate. This is the 3 components of the revised trauma score. Then we will see the assessment flow chart. Assessment flow chart, I have telling you this because first, when a patient comes to you in trauma, first you will assess the airway, breathing and circulation. Then you will go for the primary survey. When you go for the primary survey, you remember the GCS and the extremity movement is a component of the primary survey, not the secondary survey. Many times asked in NEET assess. And the component of secondary survey includes scans and imaging also. Just remember this. These are the assessment flow chart. The next thing that we are going to see is GCS, that is Glasgow Coma Scale. Glasgow Coma Scale have 3 components. One is eye opening, second is verbal, and third is motor. The maximum GCS score is 15 and minimum GCS score is 3. In eye opening, we give maximum of 4 point. In verbal response, we give maximum of 5 point. In motor response, we give maximum of 6 point. Starting with the eye opening, if there is no eye opening at all present, that is score is given is 1, that is none. If is eye opening to pressure or pain, that is given of score of 2. When we calls the patient's name and the patient opens his eye, then we give the score of 3. And when there is a spontaneous eye opening, then we give the score of 4. Then we have the verbal response. If there is no response present, then we give the score of 1. If there is inappropriate sound like ah, oo, these are inappropriate sounds, then we give the score of 2. If there are inappropriate words means if I ask the patient what is your name, but the patient says car, bus, then it is irrelevant to the question I have asked. So it is known as inappropriate words. We give the score of 3. And when the patient is confused, means I ask the question, patient understands the question and answers the question, but patient is not oriented to time, place and person. Therefore, we give the score of 4. And when the patient is oriented to time, place and person, we give the score of 5. Now motor response. Motor response, if there is no response, then we give the score of 1. If there is extension means decerebrate posture. Okay. And abnormal flexion means decorticate. Decorticate, remember like this, decerebrate, this is the brain and this is the whole cerebrum and this is the only part is cortex. This is how I remember. If the whole cerebrum is damaged, then that is more poor, then therefore we give the score of 2. And in cases of decorticate, only cortex is gone, so therefore we give the score of 3. In cases of normal flexion means patient withdraws his limb due to pain but cannot localize the pain, we give the score of 4. But when the patient localizes the pain, we give the score of 5. Better to localize the pain above the shoulder, because below the shoulder it is very irrelevant. And when the patient obeys the command, when you tell the patient to move your limb and the patient moves his limb, then means the patient is obeying your command, then we give the score of 6. So mild GCS, there is no minor. Sometimes in MCQ it is asked minor. There is no minor thing in GCS. We have mild, moderate and severe. Mild is when the score is 13 to 15. Moderate is when the score is 9 to 12. And severe is when the score is 3 to 8. So this is the Glasgow Coma Scale. Thank you for watching guys. Please do like, share and subscribe.